Hi, all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we are welcomed by Dr. Sanjay Doddamani, who is the co-founder and CEO of UpStream. And we were talking how in the interview, we had an amazing interview about how UpStream is helping support doctors, specifically primary care physicians, to operationalize, handle all of their operations and make it easier for them to care for patients, the sickest population, the ones who need the most needs, the seniors. But you told us that this mission that's so important to you is fueled by the amazing bright minds who have joined your team. So tell us, what is the secret sauce to UpStream and all of those people who are now part of your UpStream family?
Stephanie, I wish I could just summarize this in like one line, but it has been a movement that has energized people, far and wide. We have some of the top, I think, experienced professionals in the country who've come together because they've been so frustrated with the status quo. We have people from former, senior positions in government. We have experts from hospitals and health systems. We have some of the most innovative folks from, market and payer relations and health plan experience, CFOs, from, different areas of expertise, all under one umbrella, in order to, I think, revolutionize the way in which primary care physicians are supported. So it is a big movement, and I'm just the custodian of this work.
Sanjay, it's amazing. You said in the interview that there's so many other people doing this, and a lot of potential competitors, and these people could have gone anywhere else, and yet many of them are extremely well off independently, financially. Some of them had even retired, and they're coming out of retirement. Why UpStream? What is it about UpStream that's bringing them back?
I think it's this notion to be able to do this at scale. A lot of people have either started to question value-based care, or potentially some even give up and go back into a more traditional fee-for-service. The pandemic laid bare all these vulnerabilities, access, the burden, this, seesaw for hospitals on deferred care, and then suddenly, a resumption in the other extreme. And so it's all this, I think, movement and somewhat erraticness that has questioned where is value-based care at full scale, and how do we jump on a bandwagon where there is this vision around primary care can work, markets can work, support primary care physicians at the point of care, give them the right resources, the regulatory framework, the financial incentive models, and you can actually move the needle and be dramatic and successful. In our first year, we're already, crossing 4.5 stars for most of our physicians. We're reducing costs, which we then, move into their pockets sooner. And, ultimately, in total health outcomes for those who are most vulnerable. I mean, why would you not want to be part of that? But I think it has been a great journey for me personally to see what has, attracted this talent and, them coming together. And I think me stepping back to allow them to flourish in bringing their expertise into the company.
Well, thank you so much for sharing. We loved hearing about your company, your mission, and the amazing team that has surrounded you. Thanks so much.
Thanks so much.
Thank you, Sanjay.
Thank you all for watching. We'll talk to you soon. Bye-bye.